5 tips for preparing for hip surgery. And the tip number 1 is educate yourself. So some of these are going to probably be similar to the ones about the knee replacements, but it definitely bears repeating for just about any surgery. These would probably apply for just about any surgery. So number 1 is educate yourself.
Right. So you really want to know what's going on, because everybody's experience is different. And what I've found, especially with joint surgeries, people talk to their neighbors, they hear so-and-so down the block, and oh, it was a piece of cake, or they may hear somebody else say, oh, no, it wasn't, and everybody is different.
Yeah.
So you want to talk to your doctor about, your surgery, because it's going to be different than everybody else's. You also want to know, especially with a hip surgery, afterwards, what are your precautions going to be? And what are precautions? Those are going to be limitations that you will have to follow for a while.
Yeah.
And it usually has to do with how they surgically enter the joint during surgery. So do they come...
That's big for hip surgery.
Oh, yeah.
I mean, with knee surgery,
it's pretty standard.
Yeah, pretty standard.
Yeah.
The hip surgery could go one of 3 ways.
Yes, so sometimes they go through the front. Sometimes they may kind of go through the side, and then sometimes, which is a little bit of an older process, but they go through the back of the hip, and that's still done on occasion. It depends on the person. Again, everybody's surgery is different, and the doctor's going to decide which way is best for you. Okay. But there are different precautions for each surgery, like, don't roll your leg out. Don't roll your leg in. Don't don't bend past 90 degrees. So there's all kinds of different precautions depending on what surgical approach.
Right.
So that's one big thing as far as preparedness, and just generally knowing about the surgery and how long is recovery, and when will I be able to get back to driving, and things like that.
Or certain things in your life. When will I be able, so driving is kind of a big one, I think, for most people, because it's an independence thing, right? You can get out and get in the car and go. So I think that would be something that you need to ask your surgeon.
Right.
What kind of other things. So like, when can I shower?
Yeah,
I think that's of another one too, that people are always curious about. When will I be able to shower? So, and then don't be afraid to ask questions.
Right, and then the other thing is will I have home health care? Will I then go for further strengthening at outpatient? Some doctors do, some doctors don't. It just depends on how your surgery is going, how your strength is coming along, things like that. And do expect some weakness. I mean, you're going to have some hip weakness for a while. It's they have to cut into the joint, so and replace that. So, but yeah, it's a successful surgery. You just want to know what to be prepared for.
Yeah, I feel like when we talked about this a little bit on the knee replacement surgery, but I feel like when you go and you're getting ready for surgery, you're talking to your surgeon. I feel like sometimes the surgeon will make you think
it's going to be a walk in the park.
It's going to be a cakewalk. That's right, and it's not the case for everybody. Right. And so I think surgeons are in that mindset where they're just like, we're going to make, and it's right further down the road. I don't think they're very good about letting their patients know what that first 4, 6, 8 weeks are going to be like. They think they're going to just be able to get up and go. Even within 2 weeks, I think people are just like, what, 4 weeks, 6 weeks? That's crazy talk.
Still a big surgery. It's still a big surgery.
It is. It's huge. It's a huge surgery. So be real with your surgeon. Ask your surgeon to be real with you, I guess, would be a thing to ask. I think that kind of goes along with what are the risks of surgery? Yeah. Of having this type of surgery. So just, a risk of how long will it be before I can drive? How long will it be before I can take a shower? How long do I need to have, am I going to need help or home health or anything like that? That's part of side effect, I guess, of having surgery, major surgery.
Yeah.